Okay, good afternoon, everyone. Thank you so much for joining our presentation, our meeting, and discussion. Can everyone hear me okay? Great. Thank you very much. So before we get started, I just want to do a brief access check. So my name is Jonathan Novick. I'm the Outreach Manager for the Mayor's Office for People with Disabilities. Audio description of myself: I am a late 20s little person wearing a blue checkered shirt, sitting in front of a bookcase. I just want to go over a few accommodations that we have today for folks joining us via Zoom and give a sort of a rundown on what we're going to be talking about today. So for those of you who require it, we have captioning, courtesy of Total Caption. These captions are available if you're joining us via Zoom. At the bottom of the screen, you can select CC to turn on, turn off, or enlarge, or view a full transcript of the captions. In addition, we have a separate stream text link that for folks, if they prefer to view captions outside of Zoom, you can open up that link and view it separately in your browser. At the end of the meeting, we'll be circulating a copy of the captions as a transcript, as well as a handful of other things. We also have American Sign Language interpretation. We have American Sign Language interpretation courtesy of LC Interpreting Services. Because this is a Zoom webinar, we do not need to have any form of pinning or spotlighting or anything of that sort. Anytime somebody is speaking or not speaking, they will have their camera turned off, maximizing the view of the ASL interpreter. At one point, we will be sharing a PowerPoint presentation, but the PowerPoint will be sharing the screen evenly with Dr. Ige and the ASL interpreter. We also have audio description today. The only visual thing that we'll be sharing is a PowerPoint. And while the PowerPoint is being shared, we will be sure to read everything that is on the slide to make sure no one misses anything. In addition, we will be sharing that PowerPoint in an email follow-up afterward and posting it on our website. So today we are in a Zoom webinar. For those of you who have joined us in Zoom meetings in the past, this is a little bit different. A Zoom webinar basically means that for only a select few, we will be speaking and having our cameras on. For the rest of our attendees, in which case there are a few hundred of you actually, you will not be able to unmute yourself on your own, but that does not mean you won't be able to participate. After the presentation today, we will be asking for questions and comments, and there are a number of ways that you can do that. You can ask your question in the Q&A feature. For those of you joining us via Zoom, you can select the Q&A button, ask your question, hit enter, and when we receive it, we will either write an answer back and call attention to it, or we will read it out loud and we will verbally answer it. In addition, you can digitally raise your hand to ask a question. For those of you joining us via Zoom, there is a raise hand button. If you select that, a little hand will pop up next to your name. We will note that, and when we get to you, because I imagine there's going to be a lot of questions today, we will call on you and give you the ability to unmute yourself so you can ask your question. That would be if you are joining us via Zoom in the webinar. If you're joining us via phone, you can do the exact same thing. You can raise your hand or digitally raise your hand by pressing *9. And we will call on you, in which case you can unmute yourself using *6. I will re-explain this, but for now, please ask questions as they come up in the Q&A feature. If you are raising your hand, if you click it several times, as if to like flicker your hand, like, hello, hello, I have a question, that will actually put you to the bottom of the queue. So if you have one question, click raise hand and we will get to you. There's just a few hundred people on this call, so we want to make sure that everyone is heard and we get to everyone in a reasonable fashion. We will be, and we currently are, recording this webinar. At the end of the meeting today, we will be sending out in a follow-up email this recording, which will be posted to our YouTube channel, a copy of the transcript, a copy of the chat, as well as the PowerPoint presentation that Dr. Ige is going to share with us. Now, with all of that being said, it is my pleasure to introduce the Commissioner of the Mayor's Office for People with Disabilities, Victor Calise.
Thank you, Jonathan, as always, for being the voice here during these interesting times that we're having, the pandemic. You've been front and center to the community, and I appreciate all the work that you've done. You've been a tremendous support for them and, more importantly, for the office. So thank you, John. And thank you, all of you for attending today's second virtual town hall on COVID-19 vaccines. Today, we will be sharing with you the latest information on vaccine distribution in New York City. And after the presentation, we'll open up the floor to questions to hear from you and get your concerns and feedback, so we can move, when we move to the discussion portion of the meeting. So today, we are holding a virtual COVID-19 town hall for two reasons. One was because when I was getting information and our office was getting information, we wanted to get this out to you as quickly as we can. And that's why we had the first one. But today, we want to provide with you the latest information surrounding COVID vaccines in New York City. And secondly, and more importantly, we want to hear from you, the community, about what your experiences are if you've gone out to get some of these and try to sign up for it, because that's important. We want to know what your questions, your concerns, and things that we as a city might be overlooking when it comes to access and inclusion for people with disabilities through this vaccine process. And since our last town hall, we have been gathering disability-specific information. We've been putting it all in one place because I think that's important, and that's on our website. And it's in a form of questions and answer documents. John is going to put all that information for COVID-19 frequently asked questions, as he did right now. So you can certainly see that. And on this page, we have addressed those questions that we've heard from you on topics like vaccine eligibility, making appointments, and vaccine appointment accessibility. We encourage everyone to review and bookmark this webpage as we continue to update the website with more information. With today's presentation, we hope to continue on answering as many of your questions as possible and address your concerns that you may have. After this meeting, we encourage you to stay connected with our office. You can call us at 212-788-2830. You can call our ASL direct video phone at 646-396-5830. Visit our website at nyc.gov/disabilities and follow us on our social media at NYC Disabilities. I believe John put that in the chat right now. While you can always reach out to our office, we also encourage you to join our monthly community meetings. Since the beginning of the pandemic, my office has been heavily engaged with the community, holding many conversations like this one, sharing COVID-19 resources and from city agencies specifically, and soliciting feedback from the disability community. If you are not already participating in these monthly calls, we invite you to register at the link being shared in the chat right now. We understand that not everyone has a computer, and we have a dial-in option at 646-876-9923. The webinar ID is 885-3449-2671. And John just put that in the chat. And our next community call is Friday, March 5th at 1 p.m. And we would love for each of you to join us. Now, it is my absolute pleasure to bring you to the main event and introduce the Assistant Commissioner of the Department of Health and Mental Hygiene, Dr. Ige. Dr. Ige, from everyone at MOPD, thank you so much for once again taking the time out of your busy schedule to share the information and hold a discussion and really engage the disability community in the way that they need to, because you were clear, direct last time, and that open and honest conversation really got some good feedbacks, and we are so glad to have you as part of our team today. So the floor is yours.
Thank you, Commissioner, for having me again and for inviting me into this space to be part of the conversation. I am always excited to be able to share what we know about the vaccine. One, because the vaccine is really a game changer in the fight against the pandemic. I am looking forward to a time when we can go back to life as we know it, when we can go on summer vacations with our friends and family and hang out with, with friends and loved ones. So I am very excited to be able to share with you some of the information that we have about the vaccine, and also how to navigate the process. I will be doing a presentation from a slide deck. And I have been introduced. I am Simba Ige, and my job is to make sure that all New Yorkers, regardless of who they are, what language they speak, what where they live, have information that they need to stay healthy. Next slide. So I will go through a few key points in my presentation, and they are, about where we are right now. I will tell you a little about what vaccines we're working with and what they do, and address some of the concerns about the vaccine development and monitoring process. And then what we know about how these COVID-19 vaccines work. And then I will go on into how are we ensuring that the vaccines are available for everyone, the vaccine distribution process, and then how you can get vaccinated. Next slide. Next slide.
So Dr. Ige, I'm just going to step in and do a little bit of audio description, if that's okay with you.
Yes.
So this slide is called Vaccine Development and Monitoring. Next slide. COVID-19 vaccines and the status of COVID-19 vaccines in the United States.
Thanks, John. So I wanted to start by telling you what vaccines we have available now, and what their names are and the brands. So there are a lot of vaccines in the works, but the two that have been authorized for use are the Pfizer vaccine and the Mrna mRNA vaccine. There are other vaccines in various stages of testing. They have not been authorized for use yet. And this includes the Johnson & Johnson DNA vaccine, the Oxford AstraZeneca DNA vaccine, the Novavax protein-based vaccine, and then the Sanofi GlaxoSmithKline protein-based vaccine. But for now, we only have two vaccines authorized for use, the Pfizer vaccine and the Mrna vaccine. These two vaccines work the same way. Next slide. Now I'm going to talk a little about the mRNA vaccine. The two vaccines that I mentioned, the Pfizer and the Mrna, they both use the mRNA technology. And mRNA means messenger RNA, ribonucleic acid. And that is a genetic material found on the COVID-19 virus. Now, mRNA vaccines do not contain the actual virus. They only use a piece of the genetic material of the virus to produce the vaccine. And while the mRNA is a new type of vaccine, it has been studied for over 30 years. And the way these vaccines work, the mRNA, remember, they're messengers. They enter the body with instructions on how to make a protein that is part of the virus that causes COVID-19. So this mRNA, they carry instructions, and to produce these proteins trigger the body to make antibodies and other defenses. So antibodies is what helps you to fight off infections. So mRNA will help you make a protein. That protein triggers the production of antibodies that help you fight off infections. And once those antibodies are developed, the mRNA is broken down and destroyed by the body. And now the body already has the antibodies, and these antibodies are able to recognize the virus if you are exposed to it in the future and help you fight it off. So what the mRNA does is just tricks the body into producing antibodies without actually being exposed to the virus. So that is the way this mRNA works. Again, I want to say that the vaccines do not contain the actual virus. Next slide. Next slide. So that is one of the factors that makes this vaccine safe, because they do not contain the virus. Another factor is that this vaccine has gone through several stages of clinical trials. So there are 4 phases of clinical trials, and each studies whether the vaccine works and whether the vaccine is safe. So again, when a vaccine is started, when the idea for a vaccine starts, you test it first in laboratory. And then if you show that, this vaccine is safe and it actually works, it helps to prevent infection, then you go use it on a small group of people in phase 1, that's usually less than 100 people. And if in less than 100 people, you can show that this vaccine is safe and it is effective, then you go on to phase 2, which involves several hundred people. If at this stage you're also able to say this vaccine is safe, it hasn't caused any serious adverse effects, and it actually works, it helps to protect from infection, then you go to phase 3, which is thousands of people. After phase 3, where you have recruited thousands of volunteers to participate in this clinical study, if you still demonstrate that this vaccine is safe and effective, then it is authorized for use. After it has been used in thousands of people and you can demonstrate that it is safe and effective, only then can the vaccines be used by the general public. But even after the vaccine is authorized for use, there are still continued studies and monitoring after the vaccine is available to the public. And that is to make sure that any adverse effect of this vaccine is recorded and responded to. Next slide. So now I will talk to you about the phase 3 clinical trials, clinical studies for both the Pfizer and the Mrna vaccine. This is another layer in the safety process. Both of these vaccines were shown to be safe and effective across all gender, across ages, across different racial and ethnicity groups. Both of these vaccines prevented sickness or severe COVID in over 94% of the study volunteers. So now I am going to do a comparison of the Pfizer and the Mrna vaccine. Sometimes people ask, what is the difference? Should I take Pfizer? Should I take Mrna? Both of these vaccines use the same technology. They are both mRNA vaccines. Both of these vaccines require 2 doses. One is 21 days apart, that's the Pfizer. So when you take your first dose, you need to take the second dose 21 days after the first dose. Moderna also requires 2 doses, but that is 28 days apart. Both of these studies included thousands of volunteers. Pfizer had over 44,000 volunteers in the United States alone, and in other countries. And in Moderna, there were over 30,000 volunteers. Both of these vaccines also included older adults. Those who were 65 and older, there were 22% in the Pfizer clinical study, and 25% of the study volunteers were 65 years and older. Now there are also questions about if these vaccines work the same way in people of color, and the answer is yes. The Pfizer vaccine had 26% of the volunteers identifying as Latino, 10% as Black, and 4% as Asian. And for the Moderna, 20% of the participants were Latino, 10% Black, and 5% Asian. So the people of color were part of these clinical studies, and they found that the vaccine worked just the same in these different groups of people. For the Pfizer vaccine, only those who were 16 years and older participated in the initial round of clinical studies. And for Moderna, it is 18 years and older. This is why this vaccine is not used in younger people for now, until such a time when we can get clinical studies in younger people. The vaccine is still restricted to those who are 16 years and older. Next slide. So another process in the safety and the monitoring of this vaccine is the Food and Drug Administration authorization process. So vaccines must be reviewed and authorized by the US Food and Drug Administration before they can be used. So before these vaccines were authorized for use, the FDA monitored the vaccine development from the beginning to the end. The FDA also analyzes the clinical trial data to decide whether to allow the vaccine to be used. So the FDA didn't just take the word of the pharmaceuticals for it. They did their own analysis to be sure that this vaccine Jonathan, I think people are having a problem seeing the screen.
Yes, we're trying to sort this out now. Let's take a brief stop.
John, I just want to say that there's 2 pins on the interpreter as well as Dr. Ige. Everyone should be able to see the speaker and the interpreter at the same time now.
Right, well that, let's see. Hold on.
Do you want me to share from my end?
No, I don't think that's the issue. Hold on one second. So if we go back to the PowerPoint, can everyone see the interpreter, or is now, or have we lost the interpreter?
So
Interpreter lost. Okay. A few people are saying they can see the interpreter. A few people are saying they cannot see the interpreter. Some people can say both. So I think this is going to vary based on the outlet that people are using. Okay. So for individuals using a phone, they might not be able to view the interpreter. Dr. Ige, would you be comfortable if we stopped sharing the PowerPoint and you pull it up on your own and we just have a conversation regarding the information? Would that be okay with you?
Sure.
So you present from the PowerPoint, but we won't actually show it?
Okay.
Okay, so that's what we're going to do. So just be sure to speak as though, no one can see the PowerPoint. So reading out information and so on and so forth.
All right.
So that is going to be the solution, considering we don't want anybody to miss anything.
Okay.
So why don't we start over from vaccine safety monitoring?
Yes. So
Okay.
I wanted to give you a background into all of the processes that were put in place to ensure the safety of this vaccine. And so for the vaccine safety, the first process was ensuring that all of the different stages or phases of clinical trials happened. So there are 4 phases of vaccine clinical trials, and each studies whether the vaccine is safe and whether it works. So the phase 1, it involves less than 100 people. And if you show that the vaccine works and it is safe in less than 100 people, then you can go on to several hundred people. And that is phase 2. And if in these several hundred people, the vaccine works and it is safe, then you can go on to thousands of people. It is only after you have been able to demonstrate the safety and the efficacy for thousands of people, then the vaccine can be used with the general public. But even after the vaccine is authorized for use in the general public, there are continued monitoring of the vaccine to make sure they're still capturing any side effects that may happen. And then the phase 3 clinical studies for both Pfizer and Moderna, which are the 2 vaccines that we have available now, showed that both vaccines were safe and effective across all gender, across different age groups, across different races and ethnicity groups. And both of these vaccines prevented sickness or severe COVID in over 94% of the study volunteers. And I also want to highlight that the Pfizer process involved over 44,000 volunteers in their clinical study. And of this number, 22% were age 65 and older. So the study included older adults. It also included people of color. 26% of the participants were Latino, 10% were Black, and 4% were Asian. So it was based on this that, we could say that this vaccine works the same in people of different ethnicities or racial backgrounds. And the Moderna as well. There were over 30,000 volunteers involved. 25%, that's a quarter of the study volunteers were 65 years and older. And there was also good representation of, people of color in this study. 20% Latino, 10% Black, 5% Asian. For the Pfizer vaccine, the study only included people who were 16 and older, and for the Moderna, it was folks 18 and older. This is why this vaccine is still limited to those who are 16 and older for Pfizer and 18 and older for Moderna. Studies are now happening for younger age groups, for those who are 12 and older. And until that study is available, is completed, this vaccine is not being used in children just yet. Pfizer had 95% efficacy and Moderna had 94% efficacy. What that means is if you put 100 people in the room and you vaccinate all 100 of them, 95 of them will not fall sick at all if they're ever exposed to the COVID-19 virus. And for Moderna, 94% will not fall sick. So those are pretty good numbers for any vaccine. Both of these vaccines require 2 doses. The Pfizer requires the second dose 21 days after the first dose, and the Moderna 28 days after the first dose. But these vaccines are very similar in how they work, and both of them work the same way. So if you're eligible and you have the opportunity to take either of them, I will say go for it. In addition to these clinical studies, the FDA also worked on a rigorous process before the vaccines were authorized for use. So now I will talk about the FDA authorization process. Vaccines must be reviewed and authorized by the US Food and Drug Administration before they can be used. So for these vaccines, the FDA monitored the vaccine development from the beginning to the end. The FDA also analyzed the clinical trial data to decide whether to allow the vaccine to be used or not. And the FDA also continues to monitor the vaccine safety data even after the vaccine is approved. So the FDA just doesn't take the word of the pharmaceuticals for it. They do their own testing to be sure that the data is consistent and the vaccine is safe. In addition to the FDA, there are other groups involved in the vaccine safety monitoring. So there are several federal agencies and external organizations that monitor vaccine safety during the trial and as part of ongoing evaluations after the vaccines are approved. And so we have the Centers for Medicare and Medicaid Service that were involved. We had the CDC's Advisory Committee on Immunization Practices. We had the CDC's National Healthcare Safety Network. We had the Data Safety Monitoring Board. We had several clinical research organizations, all independent assessors who also reviewed the safety of this vaccine. In addition to all of these organizations, healthcare providers are also required to report adverse events that may be related to the vaccine through the vaccine adverse reporting system. And it is based on all of these different processes that we are confident that this vaccine is safe and it is effective. I will talk a little now about the development of the COVID-19 vaccines. There are some folks who are worried about how fast the vaccine was developed. And I will say scientists built on many years of research from other vaccines, including research on vaccines for other coronaviruses. So this did not start from scratch. The reason why this was faster was that scientists could leverage the research on other coronaviruses. The federal government also provided funding to allow development, testing, and production to happen at the same time. So there were a lot of resources made available to support this process. And the companies, the federal government, the state and local health departments, healthcare providers, everyone was working and planning in advance for these vaccines. So all of that made it faster for these vaccines to get to the public. This does not mean that there was any compromise in the process. So I just wanted to share with you all of the different stages, all of the different processes that were put in place to ensure that this vaccine is safe and is available to everyone. But there's things we still don't know about the COVID-19 vaccine. We still don't know how long the protection from the vaccine will last. We don't know if it's going to be many years or it's just going to be a few years. We don't know that yet. We don't know whether additional doses will be needed in the future. And we also don't know if this vaccine is safe and works the same way in children. And we still don't know whether being vaccinated prevents people from spreading the virus to other people. And we don't know if there will be other vaccines available in the coming months and how effective they may be. So these are some things that we're still waiting on additional information and data on. Now I'm going to move on to the availability of the vaccines. Right now, as of today, we have over 1.7 million doses of the vaccine that have been delivered to New York City, and over 1.4 million doses have been administered. So we are very excited that 1.4 million New Yorkers have received at least one dose of the vaccine. But on the 19th, we only had 17,537 doses available for dose one. So in a city with millions of people, almost 4 million people now eligible, we only have 17,000 doses available for dose one. So you can imagine that it's a bit of a challenge to get appointments right now because the doses are so limited. So, but we also want to give you information about those who are eligible, and when doses become more available, how you can book an appointment. I want to talk about, now we have eligibility expand to people with underlying conditions. So the currently eligible groups for the COVID-19 vaccines are those who are at risk healthcare workers, people who are 65 years and older, those who are residents or staff in nursing homes or other group living facilities, those who are frontline essential workers, such as first responders, teachers, school staff, daycare workers, transit workers, grocery store workers, etc. And now people with underlying conditions are now eligible. And I'm going to talk a little more about underlying conditions. So now I am reading underlying conditions defined by New York State. Eligibility is determined by the state government, not by the city of New York. And these are the underlying conditions that the state has identified as currently eligible for the vaccine. The first one is cancer. So if you had cancer, current or in remission, including 9/11 related cancer, you are now eligible. For those who have chronic kidney disease, they are also eligible. Those who have pulmonary disease, that's lung disease, including but not limited to chronic obstructive pulmonary disease, those who have asthma, moderate to severe asthma, those who have pulmonary fibrosis or cystic fibrosis, and any 9/11 related pulmonary diseases, they are also eligible. So lung related conditions are now eligible. People who also have intellectual or developmental disabilities, including Down syndrome, are now eligible. Because this placed them at a higher risk of contracting the virus or having severe disease. So intellectual and developmental disabilities, including Down syndrome, is now eligible for vaccination. Those who have heart conditions, including heart failure, coronary heart disease, artery disease, cardiomyopathies, and hypertension, that's high blood pressure. Those conditions, if you have them, you are now eligible. So heart-related conditions are now eligible. We also have those who have immunocompromised states. That means if your immune system is weakened for a number of reasons, you are now eligible. And this includes if you've had a solid organ transplant, or if you've had bone or blood, bone marrow or blood transplant. If you have had immune deficiencies, HIV, if you're currently using corticosteroids, if you are using any other immune weakening medicines, of any other causes that may weaken your immune system, you are now eligible for the vaccine. In addition to all of these groups, underlying conditions also include severe obesity. That is, if your body mass index is higher than 40 kilograms per meter squared or higher, you are now eligible. If you're that severe obesity or just obesity, that is when you have BMI of 30 kilograms per meter squared, between 30 and 40, they're also eligible. So I'll say that again. If your BMI is between 30 and 40 or higher than 40, you are now eligible for the vaccine. If you're pregnant, if you have sickle cell disease or thalassemias, if you have type 1 or type 2 diabetes, you're eligible. And if you have cerebral vascular disease, those are diseases that affect the blood vessels or blood supply to the brain, including a previous stroke, you are eligible. Neurologic conditions, including Alzheimer's or dementia, if you have liver disease, these are all of the conditions that are now eligible. If you fall into any of these categories or you have any of these underlying conditions, you need to schedule an appointment using either the online appointment process, vaccinefinder.nyc.gov, or you call the number 877-829-4692. So you can either make your appointment by calling this number or by going online to the website vaccinefinder.nyc.gov. Now, remember that I said there were only about 17,000 doses available on the 19th. So it is possible that you go to the website and you may not have an appointment ready at the time that you go there. And you may need to check a couple of times before you're able to find an appointment open. But if you go to that site, you type in your address, it will show you a list of locations around you where vaccines may be available. If these locations have NYC in front of them, that is, they are locations operated by the city, you will see there a description of if there is a dose 1 available or dose 2 available. So it will tell you if those sites have vaccines available or not. If you're successful at booking an appointment, then you also need to fill an Nys Vaccine Form. You only need to fill that form online. It's a self-attestation form. And then you don't need to print it out. You just need to fill it in and it will show your records. And on the day of your appointment, you need to bring proof of eligibility to the site where you're having your appointment. And then on the day of your appointment, you can also schedule your second shot on your appointment. Now I'll talk a little about the proof of eligibility. So if you have an underlying condition, there is a form that you can fill to, verify what condition you have, and a self-attestation form to say, I have this condition. You are not required to come with a doctor's note as a proof of eligibility. So I want you all to know that. And I also want you to know that there are different types of vaccination locations. There are some that are operated by the Department of Health, and there are some that are operated by health and hospitals, and there are some locations that are operated by New York State. So when you go to the vaccinefinder.nyc.gov, you will see different types of providers, and they may not look the same, and they don't have the same appointment system. And this is the reason why, because there are many different types of providers. I am going to talk a little about support for transportation to get to your appointment. If you're 65 years or older and you cannot use public or private transportation, and if you don't have anyone to take you to your vaccination appointment, the city has a contract to offer free transportation to your vaccination site. You will be provided information on how to arrange this transportation when you make your appointment. If you have access to ride, that is one option. Or if you have Medicaid, there's Medicaid supported transportation. And if you don't have either of these two, there is a curb service, and there is also Hunter ambulance service where the city has contract. And that information I will share with John, what numbers can be called to schedule appointments with curb or Hunter ambulance services. For individuals who may have problems with calling, they can also schedule transportation using the 711 service relay, or they can visit MTA accessibility and paratransit for additional information. The website for the MTA is new.mta.info /accessibility paratransit. So on that website, you will be able to make reservations for transportation to your vaccination site. I also want to say that city-run vaccination locations have physically accessible pathways to the vaccination site. If you're going to need accommodation, other kinds of accommodation, there are numbers on the site that you can call to ask questions about what support is available. So on that Vaccine Finder website, you can ask questions about what additional support you're going to need. In our city locations, you are also able to bring in someone to help you. A friend or a family member can come with you if you need additional support on the day of your appointment. They will let them in. And if you also have a home health aide that that will accompany you on the day of your vaccination, you will also be able to come in with that home health aide. It may not be possible to schedule your appointment at the same time or together, but that individual will be allowed to come in with their home health aide to support them during the appointment process. Now, I want to talk to you a little about some of the side effects you can expect from this vaccine. There are some mild side effects that may happen when you take the shot. The common ones are there may be soreness at the site of the arm. There may be swelling on the arm, and where you got the shot, there may be some redness. Some folks also have a headache. They have body aches, tiredness, and fever. These effects are temporary. They're usually mild to moderate, and they usually will start the day after the shot, and they last 1 or 2 days, and then they go away. These effects are less common in older adults, and they tend to happen more after the second shot. But again, they're temporary and they only last a couple of days. If you're worried about the side effects, if they don't go away after a few days, or if you notice that the redness or soreness is increasing, we want you to call your provider to ask additional questions. And you can also talk to your provider about taking an over-the-counter medicine like acetaminophen, Tylenol, or ibuprofen, that's Advil, to relieve your pain or discomfort. We want to encourage everyone to get their second shot, even if they have mild to moderate side effects after the first shot. The benefits of this vaccine far outweighs this temporary discomfort. And we want to make sure you get your second dose. The vaccine only offers some protection after the first dose, but it protects you more after the second dose. The 95%, the 94% protection we're talking about only kicks in fully 1 to 2 weeks after your second dose. The second dose should be the same vaccine as your first dose. So if you got Pfizer the first time around, you should get the second shot should be Pfizer. And the interval between your first and second shot for Pfizer, it is between 21 to 42 days. So if for any reason you're not able to schedule your appointment exactly 21 days after, you have a 6-week window after your first shot to schedule your second shot. For Moderna, it is 28 to 42 days after the first shot. So if there is a delay in scheduling your second shot, don't worry. You will still get the same results within the 6-week window. If it happens that you're still not able to schedule within the 6-week window, please go ahead and get it as soon as you can. But in total, you will only require 2 doses. You will not need to start all over again if you miss your second dose. You will be given a proof of vaccination card, and so want you to bring that card with you when you go for your second shot. I want to tell you a little about allergic reactions. Allergic reactions are uncommon. If you have had an allergic reaction to a vaccine or injectable medicine in the past, please talk to your healthcare provider before getting vaccinated, so that you're sure you're not allergic to any ingredient in a COVID-19 vaccine. Other types of allergies like food, pet, dust, pollen, and latex are not a concern for this vaccine. Allergic reaction usually start within minutes to an hour of getting the shot. And in all of our centers, people are observed for the first 30 minutes after their shot to see if they have any allergic reaction. Again, these allergic reactions are common. They only occur in about 5 in 1 million people. But if you think you're having a severe allergic reaction, after you get home, we say call 911 or go to the nearest hospitals. But in all vaccination sites, people are observed for any allergic reaction and they are treated if there is any. We want to remind everyone that since vaccines are still limited and not everyone can get vaccinated right now, please continue to do the preventive measures that we know work. We want you to continue to wear your mask. We want you to continue to social distance. We want you to continue to wash your hands because we know that not everyone is vaccinated just yet. So you are protected, but we don't want you to be a source of infection to other people. Like we said, we're not sure yet if those who are vaccinated can still transmit the virus to other people, even though they are protected. So until such a time when all New Yorkers are vaccinated or we have successfully stopped transmission, we want everyone to continue to do the things that we know work to protect themselves. And that is wearing masks, staying home if you're sick, staying 6 feet apart from others, and washing your hands often. If these measures, when these measures are going to be changed, we will let you know. So I will conclude with these key messages about the COVID-19 vaccines. These vaccines are safe and effective. The COVID-19 vaccines are available to all New Yorkers at no cost. The COVID-19 vaccines are available to people of all immigration statuses, and it is not a public benefit under the public charge rule. When people are vaccinated, their privacy will be protected. Vaccines alone do not prevent disease. People getting vaccinated prevents disease and saves life. So we hope that you will continue to share what you know about the vaccine with others. We want you to continue to take care of your mental health. This has been a very difficult year for a lot of New Yorkers, and we want you to continue to stay safe and practice preventive strategies. And we want you to share your stories. If you've been vaccinated and you feel comfortable sharing with others, please share your stories with others to encourage them. And we want to make sure that all New Yorkers have access to accurate information. So we have some websites where information about the COVID-19 vaccine is available. And that is nyc.gov/COVID vaccine. That is a website where you can get additional information about the vaccine. So I will stop here and take questions.
Okay. Dr. Ige, once again, thank you so much for this presentation. And everyone, thank you for your patience as we sorted through the PowerPoint versus ASL. We want to make sure that everybody gets the message and we're all having the same conversation. Now, with that being said, it's currently 3 o'clock and we have until 4 o'clock. So for the next hour, we would like to hear from you. We want to hear your questions, your concerns, and there are a number of ways that you can ask these questions. So I mentioned this before, but I want to mention it again, and we're going to go through and answer as many questions as we can. So first, if you have a question and you would like to write it out, please do not write it in the chat. The chat is for communications, for notes of ASL or captioning going, having issues, so on and so forth. If you have a question for myself, Dr. Ige, Commissioner Calise, please write that into the Q&A and we will work through it the best we can. If you would like to verbalize your question, please raise your hand by pressing the raise hand button via Zoom. So at the bottom, you should have either raise hand or you might have like a raise hand button or reaction button. Once you raise your hand, there'll be a little hand icon appearing next to your name for us, and we will be able to call on you and then unmute you. So please do that. If you prefer to sign your question, please either write ASL question in the Q&A or just raise your hand, and when we try and unmute you, we will give you the ability to turn on your camera so then you can sign your question. So we will move through as many questions as we can, and let's start with a verbal question. So I'm going to turn to Tanya. So Tanya, you can now unmute yourself and ask your question. So you're currently muted. So Tanya, I don't know if you're having any issues. Let's see. I'm going to temporarily. Are you available, Tanya? Let's see. Tanya, I'm going to promote you to panelist. So Tanya, if you prefer to sign, you can open up your camera. Otherwise, I'm going to put you back to attendee and we can try again later. Okay. All right, Tanya, we're going to have to come back to you. Okay. Next, we're going to go to someone with the username GFLOC. You should be able to unmute yourself now and ask your question. If you're there, you should be able to unmute yourself. Oh, there we go. Hello?
Hi, can you guys hear me? 1 second, sir. One moment. I do apologize.
That's all right. We can hear you all right.
You guys can hear me? Okay, wonderful.
What is your
I
question?
was wondering, I am a part of Disabled in Action, and from what we're hearing and from what I've heard personally, a lot of people with disabilities are not, even though they may fall under the bracket of underlying conditions, the community usually falls under a state of 65 and older or people with disabilities. Why isn't that an option? And I haven't heard anyone mention as far as physical disabilities go, or just people with disabilities in general and what their underlying conditions can do because of COVID. It could kill them. Okay,
Right.
why isn't this being brought to the front lines first or included in the bracket of 65 and older? I personally, from this conversation, I do apologize, have not heard anything as far as the community and the importance of them being first. I just tried to
Right.
book an appointment now, and I'm not able to get an appointment. I've heard people have been trying for months to get an appointment for their vaccines, and they can't, and they have disabilities, and they have other underlying issues. Why are we, the community, being treated lastly? And I understand the importance of frontline workers. Yes, I do. But we as a community have all been treated second or thirdly, and that's really not fair. Can you
Right.
possibly, give a reason to
Yeah.
this?
Yeah. Let me speak a little because I know that
Yes,
there are a lot of people who wonder why disability is not an underlying condition or on the list in a category by itself. Uh, the reasoning behind this, and there's a lot of, advocacy ongoing, is that, the thinking is that having a disability in itself does not necessarily put you at a higher risk of COVID-19. But that said, what they're saying is that we cannot say that everyone with a disability falls into the same bucket and put you in a group. No, but people with disabilities can be a part of many of the current phases that have been identified. So there is an understanding that people with disability may be at a higher risk because of where they live. If you live in long-term care, for instance, you will be at higher risk. So that is one group of people. There is a recognition that people with disability may be at higher risk because they have to have close contact with care providers. And so because of that, they're captured under those who live in group settings, or those who have to exposed. They also recognize that people with disability may be at higher risk because they have difficulty wearing a mask or staying at least 6 feet apart from other people or washing their hands. That is not a group that has been clearly defined, and say, how do we capture this group of people? There is also recognition that many people with disabilities also have diabetes, cancer, heart disease, or obesity. So
correct.
that those conditions are being identified there. So I think is the challenge of saying, do we group everyone with any kind of disability together, or are they included in all of the different categories that exist? Down syndrome is one condition that was specified because it's recognized that having Down syndrome puts you at a higher risk of getting very sick from COVID-19. So it's been a debate about how the community will be best served. And I know there's ongoing advocacy to the state, but it's something that's been elevated. And I know that there is um some consideration being put into how do we best serve the community.
And I'd like to also jump in to say, Dr. Ige, thank you for that answer, that it definitely is, we understand how difficult it is to get an appointment right now because of the lack of doses, because of the lack of appointments, and that, for the disability community, specifically that intersection of those with disabilities that, are an underlying condition, right,
Correct.
that it can be difficult to get those appointments. So we would like to look into the opportunity of creating something. We can't, promise anything right now, but especially over the last week with the expansion of eligibility and a lot of conversations we've been having with the VCC regarding our population accommodations and other things. This is a conversation we would like to continue with that same thought of how can we have more individuals with underlying conditions be at the line, make these appointments, and hopefully, hit a larger percentage of those
Right.
that are able to successfully get those appointments. What that's going to
And it-
look like, that's something we need to explore, but it's extremely important to us.
And it definitely should be looked into at a very high capacity, because there are approximately 1 point something million people with physical and other disabilities in New York City alone,
Right.
and within the 5 boroughs. And that's a very high percentage. And
Mhm.
if you are treating frontline workers, how are people like my PCA is supposed to assist me when I'm no longer here?
Right.
You understand?
Of course. Absolutely. So I just want to say that, this is something that we are paying attention to and we're trying to move the
Right.
needle on. So I
Mhm.
do want to move on to get to some other folks, but I'd love for you to
Sure.
join us in our monthly call. So it's not quite like this, but it is something that we do every month, the first Friday of every month at 1 p.m. We have a conversation about COVID, and what started off is, what's the city doing with the Get Food program and so on and so forth.
Correct.
Of course, naturally now we're having conversations about vaccines. So I'd love you to, I'll be sure to re-put it in the chat right now as we address the next question, but to, continue to invite other folks from DIA so we can continue to have this conversation and provide updates and so on and so forth. But I want to thank you for your question, but I do want to move on. So I'm going to disable talking and I'm going to move on to the next person, but thank you very much. Sorry, I didn't mean to cut you off already. All right. Okay, next we're going to move to Sai Chin. So Sai, you should be able to unmute yourself. Hello? Hold on. Just going to see if you need your camera turned on. If you need to turn on your camera, you can turn on your camera. Otherwise, I'm gonna put you back as a attendee and move on. Okay. Just need to unmute yourself. Unfortunately, I think we're having some trouble hearing you. I'm gonna put you back as an attendee, but please write your question in the Q&A and we're gonna move over to that in a moment. My apologies. Okay. We're gonna do one more spoken question, then we're gonna move to the Q&A. For those of you who have your hands up, please keep them up, don't toggle them because you'll go to the bottom of the list. Next, we're gonna hear from Jessica Tamber. Jessica, you should be able to unmute yourself.
Hi, can you hear me?
Yes.
Hi, so I think there should be better accessorized signs at Aqueduct Racetrack, because Aqueduct is a really big campus and there's a lot of buildings. I was there last week and my accessorized had a really hard time finding what building to go to. And then I had to tell him just keep on looking, and then he finally found it. And then going home, I just took a cab home because I didn't trust that I was going to get picked up.
Mm.
Okay, thank you for bringing that up.
Yeah.
Dr. Ige or Commissioner Calise, is Aqueduct state run or is that ours?
Aqueduct is state run, but we can certainly have a conversation
Definitely.
with Accessoride to see if we can get something posted so Accessoride drivers can find that easily.
Okay, thank you.
Okay, we're gonna, for those of you, Jessica, thank you for your question. I'm going to lower your hand and put you back as an attendee. Okay, so for those of you who still have your hands up, please keep them up, but I'm gonna move over to the written questions for a little bit now. So one of the questions, oh, okay. Amanda France asks, do we have the right to request which vaccine that we get? Dr. Ige?
Right now, because of the limited supply, when you go to a particular site, there is only one type of vaccine available. So that makes it really challenging to say I want one or the other, because most sites will only have the one type of vaccine. They will either have just the Pfizer or Moderna. They will not have both. But if you go to the Vaccine Finder website, you will be able to see what locations have Pfizer or what locations have Moderna. That said, during the presentation, I did say that the difference between these two vaccines is negligible. One is 94%, one is 95%. So that is not clinically significant. Both vaccines work the same way. They will achieve the exact same results. So I will say whichever one is available to you, it is okay to take it. There is Moderna more widely available because Pfizer requires ultra cold storage, so it's only available in the hospital settings. So you're more likely to find Moderna in more places. But regardless of whichever one is available, I would say if you're able to secure an appointment, please go for whichever one is available. They do exactly the same thing.
Thank you, Dr. Ige. Next question in the Q&A. Is it safe for pregnant women in all trimesters?
Right now, the American College of Obstetrician has recommended vaccination for pregnant women. And there is a trial that is ongoing, but only for women after the 18th week of pregnancy. But that said, during the clinical studies, there was a pregnancy register that was kept for study participants, because there were some people who got pregnant after the vaccine, they didn't know. Some people found out they were pregnant later after they had taken the vaccine and they were part of the trial. But in all of these groups, the vaccine has not been shown to have any negative effect. So that said, anyone can choose to get vaccinated in any trimester right now, according to the recommendation of the College of Obstetrician. But if you're worried, 18 weeks and older, they're already in the clinical studies right now that's ongoing.
Wonderful. This next question is from Lisa Martinez. My daughter will be 16 years old in March 27th. Will she be able to get the vaccine then?
Yes, she will be able to get the Pfizer vaccine after March 27th, after her 16th birthday. Yeah.
Okay. Pfizer, not Moderna, because
Not
Moderna is
Moderna.
18. Okay.
Yes, yes.
So putting that together, the Pfizer vaccine is for those 16 and up. The Mrna vaccine is for those 18 and up.
Right.
Okay, understood. And for anybody who is making an appointment, for example, you know, I imagine the site would be able to recognize, oh, well, you're trying to make an appointment for your 16-year-old,
Right.
then you will be getting this vaccine over this vaccine.
Right. It will not let you. It won't let you register if you're younger than the age.
Okay. Crystal Color asks, will I get sick during the vaccine?
I'm taking that to mean, can you get sick with COVID, or can the vaccine make you sick? I'll answer both questions. You cannot get sick with COVID from this vaccine, because this vaccine does not contain the virus. No virus, no COVID. You cannot get COVID from this vaccine because it does not contain the virus. Can the vaccine make you sick? The vaccine can have side effects that I described before, and those side effects may look like the flu. You may have a headache, you may have tiredness, you may feel a little sore. That is not, because you're getting COVID. It is what we call reactogenicity. It is your body building up immunity. So that will last a couple of days and then you will be fine. But some people do have those symptoms. Not everyone will get those symptoms. after the vaccine, but some people do. When I got my shot, I had soreness on my arm for 2 days, and then I was okay. I didn't have a fever, and I did not have tiredness. I was able to still go to work, but some people will have, feel tired or have a little headache as well. Not everyone, but some people do.
Okay. Great. Excellent. Okay. So this was a question that came up during the, let me turn my camera on. So this was a question that came up during the presentation aspect. When going over the amount of people that were vaccinated. Dr. Ige, to your knowledge, has there been data collection in terms of those with underlying conditions that have received the vaccine? The question is, have any of those doses been administered to persons with underlying conditions?
Oh, yes. Even from the clinical studies, there were those with underlying condition who were part of the clinical studies, those who had obesity, those who had diabetes, those who had high blood pressure, those who had HIV, they were part of the initial clinical studies. And right now, as between December 14 and February 14, 52 million US residents have been vaccinated, 52 million. And as I showed you before, over 1.3 million people in New York City alone have been vaccinated, including many people with underlying conditions. So it's safe for people with underlying conditions.
Okay, excellent. So I just want to make another brief announcement. If you have a question, please please raise your hand. There is a button that states raise hand. Please click it just once and then we will see you. At the moment, 4 people have their hands raised and we will get to you in a moment. If you are joining via, so I just saw somebody, Una Senator something. I just saw your hand pop up, but then it went away. So that did work. Just hit it one more time. Rebecca, I see you. So like we will, please just hit it once, keep it up, and we will get to you. Same thing goes if you are a person who wants to ask a question in sign and doesn't want to type it out, raise your hand. And if we don't hear from you, we will provide you with the ability to turn on your camera so you can sign your question. So we want to hear from everybody. I understand it's a process, but just to make sure we have one person speaking at a time, this is what we need to do. So I'm going to read one more question from the Q&A, and then we're going to move back to folks asking questions out loud. So Esther White asks, I heard that recent studies suggest that people who had COVID-19 can take 1 vaccine dose due to having antibodies. Will New York State make these people next eligible? Will New York State make the people the next eligible group while they still have the antibodies? Dr. Ige, do you understand the question, or is it, okay, go for it.
Yes. So if you've had COVID before, you have antibodies that last for about 90 days. So you will still require 2 doses based on the recommendations that we have now. The recommendation has not yet been changed. So even though you've had COVID before, you will have antibodies, but these antibodies tend to go down over time. And vaccine tends to stimulate more long-lasting antibodies. So that is one advantage of these vaccines. The antibodies last a lot longer than the naturally developed antibodies. So for now, you will still require 2 doses, even if you've had COVID before.
Wonderful. Thank you, Dr. Ige. Next, we're going to move back over to our questions for folks who are raising their hands. So we're going to start with Alexander Harrison. So Alexander, you should be able to unmute yourself and ask your question.
Hi.
Hello.
Hear me?
Yes, we can.
Okay. I'm in the age group between 18 and 50. When will we be eligible to get our dosage of shots?
Right now, those who are not in the eligibility that have been listed already, and they will probably become eligible from March. Later in March is when it is anticipated that everyone will become eligible when we get to phase 2. So if you don't have any of these priority underlying conditions, or you're not in this priority group, you will have to wait a little more longer, a little more patience for when vaccines become widely available to everyone.
So if you visit the COVID-19 website, there is a
Projected date.
yeah, the COVID-19 eligibility page. I just put the link in the chat. So if you visit this page, it says not only who is currently eligible, but it gives a projection for upcoming eligibility and when to expect what. So we encourage you to take a look at that if you're not currently eligible under the underlying conditions. All right, so thank you very much for that question. We are going to move on. Okay, so thank you very much. Okay, next question is going to be Christopher Greif. So Chris, you should be able to unmute yourself now.
Yes, Jonathan, I'm here. I do have I have 3 questions, but I'll make them all easy. One is regarding the, my mother who's next to me has asthmatic and has severe asthma. What is that going to help people? Because I know the fact that there was a lot of issue with asthmatics. Some people say they shouldn't take it, which I know that's not true, because I believe what you're saying more than other people. The other concern is, and I agree with everyone, but we do need to work on, scheduling a little better, because not everyone has computer access. And you call 311, they're very overloaded and congested on, contacting people. And I'm actually hearing that today in other meetings as well. But that is a really good concerns. The third question is there a way that we can invite you to future meetings?
What about, you can ask the question I wanted.
What? What's the other question?
Sorry, Jonathan, I had put
So-
it in the chat.
That's okay. Debbie, if we could just pause for 1 second. Let's just go through Chris's first few questions and then we'll go to yours, okay? So the first question was regarding asthma. So
Right.
specifically related to additional vulnerability to the vaccine. Is that correct?
Yeah.
Okay.
So
Dr. Egan.
right now, this vaccine is safe for those with underlying condition, including asthma. So what I say to folks is, does this condition make it more likely for me to end up in the hospital if I get COVID? If the answer is yes, then you should go get vaccinated. So any condition that makes it more likely for you to develop severe COVID or become very sick and hospitalized with COVID is an eligibility for this vaccine. Remember that this vaccine does not contain the virus. That's what makes it safe. So even if you have asthma, even if you have COPD, even if you have pulmonary fibrosis or cystic fibrosis, this vaccine is safe. It's safe, it protects you. What it does is protect you from severe COVID-19 infection.
Thank you, Dr. Ige. So Chris, your second question is regarding the difficulty of making an appointment. We understand not everybody has a computer or feels comfortable making an appointment online, which is why there is the phone number, not just 311, but specifically for New York City Health Department and New York City Health and Hospital run sites. You can make an appointment by calling 877-829, lost it, 829, 4692. So you can make an appointment that way. In addition, and I actually sent an email, so there is a public list of what's called Train the Trainer trainings, basically for CBOs and different partners. And Chris, I think you and I need to speak offline because I saw your response to this email this morning, but it goes over basically information on vaccine sign up, a little bit more background, and the idea is to assist individuals in understanding the process more and help navigate the appointments process. So we're hoping that we can set up more of our CBO partners to be points of contact to assist constituents who might have difficulty with computers and so on and so forth in making appointments. So we are aware of this issue and we're trying to increase the access of appointments in many different ways.
And
So-
Jonathan, regarding that thing you mentioned just now, there is
Sure.
there is a problem registering as we speak because they're asking certain questions. Mike, go ahead.
Jonathan, this was the question I put in the chat.
Mhm.
I'm asking the doctor, every time they've given me different vaccines, I react very badly.
Oh,
And I have very, very severe allergies and sensitivity besides asthma, compromised immune system. Which of the COVID vaccines coming out would be the safest for me? I've actually gotten the flu from the flu vaccine. I know there's no COVID, but still, which one would be safer for me to take?
what I'll say is the list of the ingredients in the vaccine. I can share that in the chat so you will have the list.
Okay.
But the best way will be to see if you're allergic to any of those components. If you have had a severe allergy to a vaccine before, I will say it will be better to check with your doctor who knows exactly what it was you reacted to, and then check these vaccines and see that you don't have any of those ingredients included in it. The ingredients for both Pfizer and Moderna I can share with you, but unless you know exactly what component you are reacting to, it will be hard to tell. Generally, this vaccine does not contain eggs, it doesn't contain latex, it doesn't contain preservatives. So general allergies don't tend to have reactions with these vaccines. And but if you had reactions to a vaccine before, I will say you should probably check with your provider. And if you don't have a provider, please call 311 so they can at least check and be sure before you go ahead.
Well, I do
Excellent.
have a provider, but he and I are trying to figure out which one. So it would be a big help if I got the ingredients, because we do know what I react against. So it would be a big help. Thank you.
Okay, I'll share the ingredients in the chat so you'll have it.
Thank
Wonderful.
you very much.
Thank you, Chris. Thank you, Debbie. I'm going to disable talking for you. You're going to go back as an attendee, and we're going to keep moving. Once again, if you'd like to raise your hand, you can press the raise your hand button, or if you're on the phone and you want to ask a question, press *9. If you press *9, we will see your hand and we will unmute you and you'll be able to ask your question. I want to make sure we get to as many people as possible. Next is Phil Koningsberg. Phil, you should be able to unmute yourself now.
Okay, thank you. I've been juggling between this Zoom meeting and a Parks Committee hearing on Zoom. So my question is, as a person with disability, I actually have severe respiratory failure. So using a mask, which I've been doing whenever I've been out in the public and indoors, creates a hardship. I was able to get, my wife was able to get the COVID shots, just got our second one on Friday. But what are we doing about people who can't really breathe with a mask on to go about their ways, as well as get the COVID shots in particular? Luckily, the provider accommodated me to come in from the car just when I'm ready to be vaccinated. But that's a condition we need to be concerned about, people who can't really breathe with a mask. Thank you.
Absolutely.
Yes. And those are examples of some accommodations that are necessary for certain individuals. So we encourage you to call ahead. If you book an appointment, there are numbers on that Vaccine Finder website where you can call if you need any different arrangement to be made for you. Someone had asked about, I cannot stand for a long time, will I have a chair, things like that. How long is it to walk from the gate to the vaccination site? So those numbers are included there, so you can call ahead of time and say, I need this, put in place before my appointment. And generally the providers will make the necessary arrangements.
Yes, and we are working with those sites, specifically the city-run sites, trying to increase that level of transportation. I'm sorry, not transportation, but accommodation and communication to request specific accommodations and bring up issues like the one you just mentioned. We understand that not everyone can wear a mask. Early on in COVID, we've had conversations with human rights regarding individuals being turned away at grocery stores because they simply cannot wear a mask. So we do understand this population, and we need to ensure that there is more messaging that addresses this issue. So thank you for bringing that up. All right. So I'm going to put your hand down and we're going to move on. Thank you, Phil. Next, Rebecca Arano. Rebecca, you should be able to unmute yourself and ask your question now. Rebecca, are you able to unmute yourself? Okay, Rebecca, I'm gonna promote you to panelist. If you need to turn on your camera.
Needs
can-
her camera turned on.
Okay.
Rebecca, in sign language.
Okay, perfect. Give me one moment. You should be able to turn on your camera now, Rebecca.
Yes, hello. Thank you for taking my question. I have a question. I had the COVID test and they did the nasal swab. And I waited 2 days and I got an email and it didn't actually say the word negative. I'm not really sure. It said a different word.
Indeterminate?
Hold on, please. It said not dedicated results. So I'm not familiar with the not detected results.
Okay,
Does that mean I don't have it?
you don't have it. So not detected means that there is no virus detected, no antigen detected. So if you get vaccinated, you will not test positive to COVID. Again, because there is no virus in this vaccine. So taking the vaccine will not lead to a positive result.
Okay, great. Thank you. That answers my question. And now, I do have a heart problem. So when I'm thinking about getting the vaccine, and I'm thinking about, just one second. I'm wondering if it's safe for me to get the vaccine because some of my medical problems that I personally have. I don't know if I should get the vaccine or not. What should I do?
Yes, if those medical problems make it more likely for you to get very sick if you do get COVID, then it is probably safer for you to get the vaccine. So again, the vaccine is to prevent you from getting very sick with COVID, and the vaccine has been shown to be safe for most people, unless you have had a severe allergic reaction to a vaccine before, or you're under age 16, everybody else can take this vaccine. There is no group that's excluded from this vaccine.
I see. And do I need to be over 65 because I'm 60? Can I still go and get the vaccine at age 60?
Yes, if you have underlying conditions that make you eligible, then yes, you should go ahead and schedule an appointment. You don't have to be 65 plus if you have an underlying condition.
Okay, good to know. I have an appointment with my primary care doctor on Thursday and then my heart doctor on Friday. So good to know. I guess I can then inquire about getting the vaccine. And, because I have had some sicknesses before. I'd had pneumonia before. And I'd had, one time I'd gotten another kind of a vaccine shot. It was really sore in my arm.
Yeah.
So, okay.
Yeah, you will be
All right.
sore. You will probably be sore for a couple of days. I was sore a couple of days for my first and second dose, but it will be better. It gets better usually in like a couple of days. But what we always say, if you think about folks in the hospital on ventilator, then this minor discomfort is worth it.
So, Rebecca, we're going to move on to take some more questions, but thank you very much for your question. And we're going to move you back to attendee now. So thank you very much for your question, and thank you for your conversation.
Thank you. Yes, thank you.
Okay, so we have a little bit under 20 minutes left. So I ask for everybody with verbal questions to keep them concise, and we're going to try and get to as many people as possible in the remaining 20 minutes because we have a hard stop at 4 o'clock. So I want to call attention to a Q&A that I just answered regarding eligibility for home care providers that do not have a specific form of identification. MOPD is fully aware, and we have spoken with health about this, that individuals who provide healthcare services to individuals with disabilities that are unpaid, like a family member or other care provider, they should be eligible. But then the question becomes, what way do they prove their eligibility? There's still conversations happening with the city and state. Once we have an answer, we'll update our Q&A on our website as well as incorporate it into all of our messaging. So unfortunately, we're still waiting on that answer, but once we have it, we will share it. Let's see. Quick question from Debbie Bennett. Is there a plan for people who do not leave their homes to get vaccinated at home? So Dr. Ige, could you speak to Johnson & Johnson to the extent that it has been planned?
Yes. So this is a plan that, the city has been working on for a while. And right now it seems like there are some possibilities in the near future. With the possibility of Johnson & Johnson vaccine becoming available soon, the city has started planning how home vaccinations will happen. This is because the vaccines we have right now, the Pfizer and the Mrna, they are very difficult to transport around because of the cold storage that's required, and they are unstable. You cannot move them around. But with Johnson & Johnson, I think that has a greater stability and can be used for vaccination at home. Just last Tuesday exactly, the mayor, announced the plan. They're working with FDNY for how, seniors who cannot leave home can be vaccinated at home, and others who cannot leave home can be vaccinated at home. But while we wait for that, there's also a plan to make sure that home health aides who are working with those who cannot leave home are being vaccinated, so they're not serving as a source of infection to those who are not able to leave their homes. So those are two ways that the city is working towards, protecting those who are not able to take the vaccine now because they are at home and they are not able to leave their homes.
Okay, thank you very much. Next, quick question. What are the side effects of taking Tylenol after taking the vaccine on the same day?
Generally, the recommendation from CDC is to wait. If you have pain and you feel like the pain, is severe enough for you to require pain reliever, then go ahead and take it. We do not recommend that you take it in advance or, before you take the vaccination. But after taking the vaccination, if you're experiencing pain and you need relief for that pain, then it is okay to take Tylenol or Advil for that pain if you don't have any contraindications to those medications.
Okay. Question from Michael Murdoch. When are the pharmacies opening up to people with underlying conditions? So a quick point here. underlying conditions are eligible within New York State, but that guidance is currently being that guidance is currently being followed by city and state locations, not all pharmacies. I believe the pharmacies are following the federal guidance, which has not been opened up to underlying conditions yet. So I believe, Dr. Ige, please jump in if I'm wrong, once the federal guidance comes down for the private pharmacies, that's when we will see underlying conditions, but we don't have a timestamp for that yet.
Right.
Okay, thank you very much. We're going to pivot to a few verbal questions. Victor Andrews, you should be able to unmute yourself and ask your question.
Thank you, Jonathan and the team, and Victor, Calise, and our doctor. I'd like to know, I can't take the vaccine because it's made out of eggs and formaldehyde. So the question is, what are they going to do with the people who can't take it, who are allergic to eggs?
This vaccine does not contain eggs. If you have allergies to eggs or to any food-related allergies, it is not a problem for this vaccine. The only people who should be bothered are those who have had allergic reaction to a vaccine in the past or to injectable medicine in the past. This vaccine does not use eggs because it didn't have to culture any virus.
Okay, Doc, which one? Because there's 3 of them out there. One of them is.
The two that we have right now, Pfizer and Moderna, neither of these 2 use eggs because they're mRNA vaccines. They don't use live culture, so they did not use eggs. So egg allergy is not a problem. For Johnson & Johnson, it's not authorized for use yet. So until then, we will know more when it's authorized for use. But the 2 that we have available right now, neither of them use eggs. So egg allergy is not a problem.
Okay, thanks, Doc. Thanks, Jonathan. Appreciate it, buddy.
Thank you, Victor. All righty, let's keep it going with Glynis Gibson. Glynis, you should be able to unmute yourself now. Unless you need your camera turned on. Glynis? Hold on one moment. Second. We're gonna give you should be able to turn on your camera now. Glynis, do you need, if you need to, you can turn on your camera to sign.
Sorry, okay, I have it now. Hi, everybody. This is Glynis speaking. I'm a domestic violence counselor for Independent Living Center. So I have a question about one of my clients that I work with, and they're concerned about the fact that you have to wait 21 days to get the second shot or 28 days to get a shot. And their question is, what happens if you forget the second shot? Or what if something happens? Or what if you have to wait like 23 days or something and you miss that time for the second shot? What should she do then?
Yes. So if you miss your second dose appointment, you are good to reschedule within 6 weeks. So if you took the Pfizer vaccine, you can schedule your second dose anytime from 21 to 42 days. If you took the Moderna, you have a window from 28 days to 42 days after your first shot to schedule your second shot. So within that period, you are fine. There will be no need to start the series all over again. You will only still need 2 shots and you will be fine.
Dennis, thank you for your question. We're going to move on because we just have a few minutes left. Thank you.
Actually, I do have one other question.
Sure.
My other question is people who have people who are allergic to fruit. Does that have any impact on their ability to get the vaccine, or is perhaps side effects to the vaccine? Anything about fruit allergies that we should be concerned with?
No, not for now. Food, fruits, they don't impact this vaccine.
Wonderful.
Okay, great. Thank you so much.
Thank you very much. Okay. All right. So going to.
Oh, I did have one other thing that just came to mind.
Okay.
People who have the flu, or I'm sorry, people who have allergies to the flu vaccine and can't get the flu vaccine anymore because they have problems with dizziness with the flu vaccine. So does that mean they could have the same problems with the COVID vaccines?
It's hard to tell if what is causing the dizziness. If it is an allergic reaction and you have a rash and you have difficulty breathing and you have the hives, then that is a severe allergic reaction to flu. You should probably check with your provider before you go ahead and try the COVID vaccine. But if the dizziness is not a reaction and you're not able to say that it is the flu vaccine that led to the dizziness, then it is difficult to tell if what is causing the dizziness and if this vaccine will do the same thing.
All right. Thank you, Glennis.
Okay, thank you so much, and thank you for your time.
Thank you.
Thank you. Bye-bye.
Okay. All right. So Josh Weitzman asks, is there a day of the week that is better to look for a vaccine appointment on the website? For example, when are new batches going to be released? Is there a special magic hour where there's new appointments? It's a good question.
Yes. So right now, the city operated sites, particularly the Department of Health operated sites, open on Thursdays to Sunday. So Thursdays, Fridays, Saturdays, and Sundays is when new doses become available. We're not able to take vaccination every day anymore because supplies are just too limited. So those are good days to check. And the site will tell you if we have first dose available, so you can see. I know that some individuals have taken it upon themselves, and this is not an endorsement from the Department of Health, but there are some individuals that have put together some crowdsourcing information to help you know where appointments are available. And I know one of them is TurboVax. I haven't used it directly, TurboVax like TurboTax, but Vax. And another is NYC Vaccine List. So on this side, they say where appointments are available. So those are some ways that people are trying to keep up with where do we have appointments open, and is this appointment for first dose or second dose? But for the Department of Department of Health operated sites, we run our clinics now on Thursdays, Fridays, Saturdays, and Sundays.
Wonderful. That's good information to know. So we're going to answer a few more questions, but we unfortunately will not be able to get to everybody. So I encourage you all to please send me an email at jnovick@cityhall.nyc.gov if we don't get your question, or call my number 212-788-2856. These are both points of contact to make accommodations for this meeting. So we are trying to answer as many as we can. So please feel free to reach out to me. This is an ongoing conversation, and we want to continue having it. So with these last few minutes, I'm just going to address a few more. So Anonymous asks, I may have missed it, but what are the scheduling options for people who use ASL only? I haven't seen a video phone or TTY link or anything similar. So for city sites, as mentioned, there are points of contact, but we are working with the VCC to streamline this process. So for individuals that go to a city site, they're using a language line service that would allow for video remote interpreting services. Now we understand there can be some issues in this area for communication, but we are staffing and providing the facilities operated by the city to the point where any person who is deaf should be able to attend, schedule an appointment, and then receive the information they need to in a language that works for them. But we are working on developing a more streamlined process for asking for particular accommodations, not only for the process of doing it, but for advertising it more. So, we don't want people to need to look particularly hard for this information. We want to have a stronger conversation about accommodations and where to find them so people can be at ease when they show up to their appointment, that they will be able to have what they need to get their vaccine. So it's something that we're working on. For the city sites, there will be ASL and interpreting services available, but we are working on expanding these services and advertising them more thoroughly. All right, so I think that's about it for time. I want to repeat myself that please direct any unanswered questions to my phone number, which is 212-788-2856. That's 212-788-2856. Or email me at jnovick@cityhall.nyc.gov. That's jnovick@cityhall.nyc.gov. We will be sharing a recording of this presentation and this discussion, a link to our Q&A, the chat, the transcript, as well as the PowerPoint that Dr. Ige was showing during this presentation. And we'll also be, continuing to have more conversations like our monthly community call, which is going to be once again on March 4th. That's the number 4. It's a Friday at 1 p.m. You should be able to register. We promote that on our social media, through our email blasts and others. So stay tuned, stay connected with us. We really appreciate your time today and your patience as we sorted through some technical issues, but thank you for your advocacy, for your questions, and for your involvement. And we hope to continue to have events and conversations like this again soon. Commissioner Calise, Dr. Ige, thank you so much for your time today. And a huge thank you to ELSI Interpreting Services and Total Caption for making this an accessible conversation. So thank you all so much, and I hope everyone has a great week. Goodbye.